Good afternoon, everyone. This is Woody Collins with Congo Helping Hands, and this is another edition of Talking About the Congo. Uh, as you see, I'm sitting in front of a green screen with the Kananga in the background. So I am not at the farming project. I'll talk about that in just a little bit. But to talk about my main topic today is about health workers, healthcare workers in the Congo. One of the things that I read this morning was talking about how healthcare workers over the last 2 years have been really working hard. They had an Ebola outbreak in 2018 that started over in the east, and then they had the coronavirus, and now they got another outbreak of Ebola going on again. They've had measles outbreaks that's killed about 7,000 people over the last year. Uh, Monkeypox, all those type of things that has happened. And at the forefront of all of that is the healthcare workers. When people are sick, they come in to the healthcare workers to see. There may be a village, they may have walked miles to get to a healthcare worker. And so they come in tired, suffering. Some of them actually die on the way into health clinics. And you, you know, it's just a terrible story. But the biggest thing of it is that I think from the healthcare worker standpoint is that they have to treat these people. Number one, they have to treat them with whatever they have. They don't have a lot of medicines, they don't have a lot of equipment to diagnose what's going on. They have to use their best knowledge that they have on to try to treat them, to get them well. And many times they send them off saying, okay, go buy some medicine, uh, you know, because they don't have it available. Another thing is the healthcare workers are not paid that well, and they're not paid sometimes often enough. So therefore, the healthcare workers, they're underpaid, not paid. Also, you have to look at the standpoint of they don't have, like I said, they don't have the equipment, the facilities they work in. They are being subjected to not only whatever the person may have, it could be something that's infectious, uh, it may can be as simple as a breech baby in a for delivery. But a lot of times they see women, children die. One of the first things that I saw when I was in the Congo, this was back in probably 2001. There was a nurse that was at the hospital, and her baby had contracted a disease um, that I'm not sure what it is called, but it was had the swelling of the head, hydrocephalopathy, and they was seeking treatment. And one of the only things that they could have thought about was getting that baby to a hospital in Kinshasa. And we were trying to make arrangements to do it, and we, didn't have the money, so we got, uh, you know, got people to donate money, and we started her on the trip. However, the baby died before uh, they reached Kinshasa to have this operation. I've also known doctors to lose babies. So, not only that they see other people dying, but they also see their loved ones that's passing away. So it's a tremendous mental uh, battle for them and thing. And so we've been talking about here in the United States how our healthcare workers are heroes. And I just wanted to bring up the fact that healthcare workers, especially in the Congo, are really heroes, and they are saints because they not only see people that's dying, they also see their loved ones dying, their patients dying because they're getting low pay, working in hard conditions, without medicines, without equipment, and those type things, and it takes a toll on them. I don't see them grumbling. They haven't really grumbled to me or anything like that, but I can imagine what they must be going through because I've seen the anguish on our healthcare workers here in the United States with this current pandemic. But I can just imagine what it is like for the Congolese healthcare workers, that's under, number one, extreme conditions from the beginning, and still having to see death and things that they can't control or cannot solve for people as they come into the hospitals and things. So I just want everybody to know, when you see a healthcare worker, salute them just as as a saint because they're working under really extreme conditions, and especially those ones in the house in the Congo. So please pray for the healthcare workers because they're on the front lines, and they see a lot of times they see exotic and deadly diseases. You know, what would you do if you saw someone coming in with Ebola? You see someone that coming in that couldn't hardly breathe. They had, uh, you know, a virus of measles, and you didn't, and they, what you do with measles? How about cholera? All those things are not pleasant to think about, but that's what they face with on a daily basis. So, please pray for healthcare workers around the world. One of the things, as I mentioned earlier, I'm not at the farm today. I got there and sit down in the auditorium, and I just did not feel comfortable. I don't know whether it's the case of it's my first time really out in public since, well, I not, shouldn't say out in public. I go out in public, but it's under controlled conditions. Go to the grocery store real fast, uh, go shopping, go out for walks and things like that. But sitting down in a auditorium, and we were properly, you know, distance apart. I would say no one was really sitting close to me, but it just kind of just it didn't feel right. So I was under more stress sitting there among the people than I was, feeling, normally. And I thought this is not good. That I'm here to enjoy a conference, and I'm not feeling well about it. So at lunchtime, I just decided, okay, this is not for me at this time. I would really like to take the class, take the training. It was the first morning session was great. Uh, I learned a lot and really think it's something that we need to institute in the Congo, farming God's way. Uh, and they showed some, real success stories on how to do it. And I think to me, it made a lot of sense, and I was really interested in it. But I don't think I was in the frame of mind and physically ready to, I say mentally ready. Physically, I was okay, but mentally, I wasn't ready to sit there and be among people. And probably what was really distressing was a lot of, probably 90% of the people, even though they were physically distant from others, they didn't have on their mask. And I just felt that, okay, this is not good for me. So I need to just kind of get out of this environment and come home and do something else. And I picked up some flash disk that has all the lessons on it, and I'll go through it and study up on it. But in person is not ready for me at this point in time. So I don't know how you feel about it, but maybe, I've been hibernating ever since March, meaning to say I've been really restricting my movements, haven't been out to restaurants, haven't been to church settings, anything like that. I just see people from a distance, go out and run, or go out and do walking. Been to a couple of meetings, but it wasn't that large of a group that I could sit there, so I was really uncomfortable. So, uh, maybe tomorrow I can do better. I shouldn't say tomorrow because I'm not going back tomorrow, but maybe in a few months I can be a lot better off. So thank you for tuning in, and thank you for and also asking you to pray for those healthcare workers that they be taken care of as they treat people with all kinds of illness. We think about our mothers who used to be our frontline uh, person, but right behind our mothers and fathers who take care of us when we're sick is the doctors and healthcare workers. They come in next. They're the ones that we really, when things get rough, we go to, and so just lift them up and and uh, and just pray for them. Take care. We'll see you tomorrow at 3 o'clock. So this is Woody Collins from Congo Helping Hands. We'll talk to you later. Have a great day. Be safe and be blessed.